Hello, hello, my friends, and welcome back to my channel. I have been wanting to do this video for about a week now, and for one reason or another, it just hasn't been able to get done. But this has been weighing on my heart and heavily on my mind that I have a rant that I need to just get out. It has some nights even been keeping me up because it involves kids. And, you know, when babies, and by babies I mean children, are being hurt by current guidelines, by government nutrition, anything, we have to take a stand. And so I do coaching, and typically if someone comes to me for help, it's because whatever they've been doing isn't working and they need some guidance, and they need help getting their health back on track. They're usually like, I'm a last ditch effort because they haven't been able to work on their diabetes. They keep getting put on more medications. Maybe they're extremely overweight and nothing they have done has helped, and they've yo-yo dieted, or they're in just a ton of extreme pain, and so they reach out to me for help. And I am extremely blessed to be able to walk with these people in their journey, and I feel extremely honored that they would reach out to me for help and to walk this path with them. And I got to thinking, especially after chatting with a couple people, that when they first were diagnosed with diabetes many years ago, type 2 lifestyle diabetes, rather than be told, hey, if we just cut out the foods that are increasing your blood sugar, we can nip this in the bud, they weren't. And so one medication led to two medications, led to insulin, led to gastric issues where their stomach nerve was actually paralyzed. So then they weren't emptying. So that led to surgery, which led to another medication, which led to another surgery. And it's just been a big spiral. And now, because of some of the things that these surgeries have done, it makes it very difficult for them to get where they need to be. And all of it could have been prevented, or at least not end up as detrimental, if diet would have just been changed right away. And I got to thinking, I'm a people watcher. And so when I go to the grocery store or I'm out and about or, whatever, I watch people. And the majority of the people that I see don't look healthy. And I'm not talking just fat, because I'm fluffy. I'm not no toothpick. But being skinny doesn't make you healthy. You can actually be very skinny and very metabolically unhealthy. So weight and body composition does not always equate health. But when I look at statistics and I read the literature, and we have more and more kids and teenagers that are overweight, dealing with anxiety, depression, when you've got 10 and 11 and 12-year-olds that are suicidal, something has to be done. And I'm not saying that diet is going to fix everything. But diet and lifestyle is the core. It's the crux. It's where everything needs to start. I know from my own experience and from my oldest experience that how we eat completely affects where our anxiety and our emotions and our mental status goes. And even my husband. So if we like binge on crap, and by crap, I mean what the food pyramid says is healthy, we will spiral with depression and anxiety. And it's not good. If you are on my channel, you can see an interview I did with my oldest a few years ago, because she was like struggling with suicidal thoughts and anxiety and depression. And the food made the difference. And so I got to thinking, I love documentaries, and I am a documentary junkie, especially with the nutrition. And I'm so glad that they're out there and spreading awareness. But what if we didn't need them? Like, they're great to help our adult population see what's going on and how to fix or at least halt some of these chronic health issues. But if we don't use them to start teaching prevention, then all we're doing is breeding a new generation that's going to get sick and then see diet change, whether it's low carb, whether it's keto, ketovore, carnivore, whatever, as a cure instead of a preventative. And if we could start changing the medical guidelines, and they are, some of them are changing, but unfortunately we have the government that just keeps making things very difficult. When you've got the My Plate, which is now the new food pyramid, and it's just complete bogus. Like, these nutritional guidelines, if you look at the history of all of this, I'm not going to go into it in this video because it would take too long. But look into John Kellogg and a couple of the other, I think they were Seventh-day Adventists. The whole premise behind the plant-based, stop eating meat, a lot of that was a push by John Kellogg and others in that realm because according to them, eating red meat caused you to masturbate and cause sexual desires, and those were sins, according to them. And it's just a horrifying, disgusting history. So that's where all that plant-based, this was back in the 1800s, where all the plant-based started getting like pushed. It's not off of any nutritional information. It's very interesting history, and perhaps I'll do a video on that at some point in time. But when we look at like what we have now for government recommendations, they are literally killing our kids. Look at WIC, Women, Infant, and Children, if you're in the United States. A lot of the states have this government program, and it's for pregnant mothers and children, infants to either 3 or 5 years old, something like that. They provide money, government subsidies basically, for certain foods, juice, and just because it's no sugar added juice doesn't make it healthier. When I was growing up, we didn't have type 2 diabetes all over the place. And if there was type 2 diabetes, it was in the older generation. Now our little 9 and 10 and 11-year-olds are getting type 2 diabetes. That is not the autoimmune diabetes. That is caused by our diet and lifestyle. We've got little kids that weigh way too much, and it's affecting their mobility, their joints, they're in pain. They have fatty liver, and you know why they have fatty liver? Because they chug juice all the time. They get sugar at every turn. And even if a parent is trying to feed them healthy at home, not have juice in the house, not have candy, not have sweets, not have refined flours, ultra-processed foods, then they send them to school. School undoes all the dietary changes because most schools provide breakfast and lunch. And it's junk. It's complete crap. When you can count pizza as a vegetable, we have to start changing these guidelines. And the only way that we're going to do it is through grassroots movements. We have to start educating these children to start standing up and saying, no, I'm not eating that. If we were able to stop all of this and all this ultra-processed foods, then we wouldn't need to look at a low-carb diet as a cure for disease when they got older. Why? Because they'd be metabolically healthy, and they'd know how to stay metabolically healthy. So then they'd be able to enjoy a sweet potato every now and then, some fruit in its form and seasonally, how it's meant to be. Not in fruit juice that's making us sick. I'm not anti-vegetable. Sometimes it seems that way, but that's because vegetables don't agree with me, certain ones. And I'm not anti-fruit. But our fruit is not, most of it is not healthy because it's genetically made to be full of sugar. Fruit historically was not as sweet as it is now. My kids enjoy berries every now and then. I keep them here frozen, and they will have them as a dessert. That's just fine. We have an apple tree. We've got a cherry tree. We've got some pear trees that hopefully soon will be producing. We plan to eat those things as they grow. So if we could teach these children and start changing the guidelines. You know, when my daughter was in the hospital last summer, not summer of 23, but of 2022. She was in the hospital for 3 days for a face infection. And the menu that they had for her to eat was nothing but carbs. All processed crap. There was barely any protein. It was just junk. And that's in the hospital. And they expect you to keep your immune system up and beat illness by feeding you nothing but processed, ultra processed carbs and crap? I think not. We're made up of protein. We need protein. I was just in Chicago a few days ago for a meetup. And my friend Carrie from Homestead How is working with some other folks on a documentary called Healing Humanity. And it's going to be epic. It's going to be phenomenal. And he's got a lot of doctors behind him. I got to meet Dr. Tony Hampton there. And, we had a good chat. We had a good chat about how these guidelines need to be changed. And Dr. Hampton was talking about how in some areas they actually are, they're being able to get in there and teach these doctors nutrition, real nutrition, not big pharma nutrition, not big food nutrition, but real nutrition, and not to fear the fat, and to learn how to, keep carbs low. If we were able to teach these kids how to cook, that's a lost skill. And it's not that I'm some great cook either, because I wasn't taught how to cook anything but ultra processed foods, because that's what I was brought up on. And that's why my health has been crap up until a few years ago. Because I had no clue. But if we were able to teach them to stay away from the things that really cause inflammation, like wheat and other grains and things like that, but that if they stay metabolically healthy so that they can handle a little bit of a higher carbs, then they would be able to have some bread made from like sprouted grains. Bread that's not like ultra processed white flour, which is addicting and hits your brain just the same as cocaine. It's not that these foods are bad. I mean, the ultra processed like white flour crap, yes, that's bad. But it's not that some of these other foods, like bread made from spelt and stuff, it's not that those are inherently bad. It's that the majority of the population is so metabolically unhealthy that they shouldn't be having them, because they need to heal their metabolism. But if we could stop that now with our young generation, keep working on healing my generation and those, before me, so the older generation, keep working on healing them, teaching them to teach their kids. Then by the time those babies are grown, they're going to be healthy, and they're going to pass that on to their kids. But we have to start now. And we have to, send food with the kids, start packing their lunch. I know it's not easy, and I know not everyone can homeschool. I wish everyone would. I wish we got rid of these governmental institutions. But I know in reality, that's not how it is. So maybe we need to start teaching them to take their own lunch. And ensure that the school, because I have read in some areas where the school will send home a note saying, you can't just send them, with meat and cheese or whatever. They need X, Y, and Z, and they'll take that lunch away from those kids. So I don't know what we need to do, but we need to band together and we need to do something for prevention. You know, this is going to be a grassroots, boots on the ground movement, and it needs to sweep far and wide. Because when my daughter can come to me shortly after Halloween, we let them do trick-or-treating, and my kids are metabolically healthy, and so we let them keep a couple pieces of their candy, and the rest went in the trash. We swapped them out for other things. But yes, they did keep, we'd go through and read the ingredients, and so they kept a couple of the least bad things. But when my 10-year-old's sitting there reading the ingredients, and she can't have wheat, and she had just read on like the different dyes that are in foods and the illnesses they can cause, one including cancer. And she comes to me with a package of gummies, which we don't do gummies, but she said, "Mama, these have red dye 40 in them. Did you know red dye 40 can cause cancer?" And then she reads and she said, "And these have wheat in them too, and wheat isn't good for you. And it's especially not good for her. And this is out of the mouth of babes." And she looks at me and she says, "Why do they want us sick? Why do they want us sick?" I belong to Dr. Barry's private group. And in the private group, it's really great. We get extra like one-on-one lives. I guess not one-on-one, but it's him, not on YouTube. And the level that I'm at, I get a Zoom call with him once a week. And there was a gentleman who's also at that same membership level. He's in a different country, not in the States, although I've heard of this same thing happening in certain areas of the state where the government thinks they know better. And I don't remember the exact setting. I don't remember if it was that his son was a type 1 diabetic or had some sort of issue, but the parents shared with the doctor that they were doing a low-carb diet for their child. Well, the doctor didn't like that because they were trying to get the kid's medication either lowered, like insulin lowered, or get him completely off. Again, I don't remember all the specifics. So the doctor called the authorities. And now their equivalent of Child Protective Services for what we have is involved in these parents' lives, all because they were trying to take control of their child's diet and do what was right for him. And yes, that has happened here in the United States as well. You get a pediatrician that doesn't like how you're feeding your kids, and they feel because you're not giving them bread and cereal for breakfast, they're going to call social services on you. Yes, I know firsthand that has happened. It has not happened to me. But then we wonder why people are so gun shy to go to the doctor. The very few times that we have to go to the doctor, when they ask, about diet, we simply say, we eat no processed foods, we eat a whole food diet, and we focus on protein. None of that's a lie. We don't tell them, hey, we eat keto, we eat carnivore. None of it's a lie, but it's not their business. Now, we have a wonderful physician who knows how we eat, and she's totally cool with it. But like if we had to go, say, to the emergency room or what have you, or if we ever end up like losing this great physician and end up with another one, it's all we say. We eat a whole food diet with no ultra processed foods, and we focus on protein. And I encourage everyone to approach that, because you don't need your doctor's permission to eat any one way. And you don't need your doctor's permission to feed your kids any one way. So I guess that was just my rant, because it hurts my heart when I see these kids so metabolically unhealthy. And I see these teenagers and young adults, and then people my age, so sick. It's like, if we would have just had this knowledge, we would have been, pardon me, we'd be so better off. I love helping people, and I love educating. Like, that's just who I am. I soak up so much knowledge, and I take courses, and I love learning, and then I love just sharing what I learned and helping others. But it breaks my heart to see someone, especially someone that I love and care about, basically have been put through the ringer by the medical profession because they were never taught. Because it was just, let's just add this drug, and then this drug, and then this surgery, and then this surgery. And it happens all the time. There are very good doctors, but they are too few and far in between. So many of them are overworked. So many of them are perhaps in a system where they'd love to make a change, but they dare not stray from that system's guidelines, or they'll be booted out and then not be able to help anyone. We need 1 million more doctors like Dr. Hampton, who is actually practicing in the Chicago area, and he's allowed to practice in a preventative manner. He's allowed to do diet changes, and he doesn't have to fear the repercussion of getting someone off of medication instead of adding medication. We need more of these advocates, and we need them to be out there educating our school systems, the school nurses, the pediatricians, because then we need those pediatricians educating the parents and the hospital nutritionists and the dietitians, and like, we need them to start getting a clue, because they're killing our children. WIC is a lifesaver for so many people, but that program could be so much better. How about, for protein, instead of paying for beans, they pay for a pound or two of ground beef? How about, instead of providing 4 or 5 jugs of juicy juice, let's increase the amount of fruit that you can get for that child. Like the whole food. Instead of rice, how about some sweet potatoes? I think those changes, I don't know. I'm just ranting because I'm so sick and tired of seeing our children sick and tired. When you read the headlines or, things, and they're talking about a 10-year-old being suicidal. Yes, I get it. It's not all diet. Society sucks in a lot of areas. You've got bullies. Kids can be mean. I get it. But we shouldn't have these little kids in therapy sessions because they've got such bad anxiety. We shouldn't have kids being thrown on Ritalin because the school is jacking them up on all kinds of artificial colors and processed carbohydrates that their brains are just going a mile a minute and they can't function. A lot of this could be solved by nutrition, or at least made, I'd say, 80% better. But no one knows, and then when you stray from the norm, you're a crackpot. So, I am glad that I got that off my chest, and I got to share that with everyone. If you have any thoughts or ideas on how to change the system or infiltrate the system, or you're ready to start a grassroots movement in your area, leave a comment on this video, and maybe together and with powerful or well-known people like Dr. Hampton and Dr. Berry, and some of just the other really fine doctors. You've got Dr. Bickman. I know he's not an MD, but man, the guy's brilliant. And then we've got really, really other popular advocates that perhaps are like myself, not in the medical field where they don't have letters behind their name, but they've got 10, 15, 20,000, a million subscribers on their YouTube channels. We put all of that together and we could maybe start making some sort of change. But we've got to start protecting these babies. We have got to do better for our youth because what's being done now just is not acceptable. It's not acceptable. But I want to leave on a really good note. One of the people that I have been helping that has been royally screwed over by the medical field is doing really great. Their healing is coming along, and I know that it's just going to get better and better. And I am super grateful for doctors like Dr. Tony Hampton, and it was such a blessing to meet him in person, along with Carrie and the Carnivore brothers and Carnivore Today, and the documentary that is coming out healing humanity is going to be phenomenal. So if you would go to Homestead How on YouTube, and you can subscribe to Carrie's channel to stay up to date with what's going on. That is my positive end to this. If you are not already subscribed to my channel, please make sure that you do subscribe and share this video with anyone that you think it might touch, or that they could just use the information. So thank you for hanging out with me, and we'll talk again soon.